With prostate cancer as the most common non-skin cancer and the second most common cause of cancer-related deaths in men, it's important to understand the disease and be aware of screening options. You probably know someone that's been affected by prostate cancer. It's fairly common. In fact, approximately 1 in 6 men will develop prostate cancer during their lifetime, and 1 in 36 men will die from the disease. However, if caught early, it's treatable with a high cure rate. How do you know if you have prostate cancer? Most men are diagnosed with prostate cancer because of a routine screening, not because of symptoms. However, it's a good idea if you experience any of the following symptoms to call and make an appointment for a screening. These symptoms include difficulty starting urination or holding back urine, weak or interrupted flow of urine, painful or burning urination, difficulty in having an erection, painful ejaculation, blood in urine or semen, or frequent pain or stiffness in the lower back or hips. A prostate cancer screening can involve both a digital rectal exam, or a DRE, and a blood test for prostate-specific antigen, also called PSA. In a DRE, a doctor inserts a gloved finger into the rectum and feels the prostate through the rectal wall, checking for any firm or nodular areas. With a PSA test, a lab checks the levels of PSA in the blood. About 75% of all newly diagnosed prostate cancers are found because of PSA screening. It is important to be aware that PSA levels can be raised for a number of reasons besides prostate cancer, such as urinary tract infection, inflammation of the prostate, benign prostate hyperplasia, and even ejaculation. An abnormal PSA result does not necessarily mean you have prostate cancer. Know that screening with a PSA test and DRE is currently the best way to catch prostate cancer in its early stages before it becomes life-threatening. It's recommended that men over 50 talk to their physician about screening. However, African American men and men with a family history of prostate cancer need to be screened around the age of 40 due to higher risk factors. If the testing does show concern, a prostate biopsy may be done for a definitive diagnosis. If a diagnosis is made, there may be many treatment options available, including robotic surgery. The important message to note is that you can't be treated if you're not diagnosed. And to be diagnosed, you have to be screened. So call for an appointment today.